so people are more cautious. Although, oh, did you guys know there's going to be a rally today at 1 o'clock on the Capitol for Planned Parenthood? Or it might be NARL, because believe it or not, there is a bill introduced to make abortion a Class 3 felony with fines. That's going to be heard today at 1:30 in the House Judiciary Committee. And so NARL is going to have a rally on the west steps of the Capitol at 1 o'clock, so if you're around and the weather is still holding up, I'd encourage you to attend. I think it'd be great to have a good show of support. And I was about to say that because in the election year, people are being more thoughtful about the legislation they introduced, but perhaps not. And then in addition, as you all know, despite the hard work of many of you, our majority in the Senate in the Democratic Party at least has gone from 2015 to 1817, which means that if one person on your side doesn't agree with you, it's hard to get a bill through. And so you'll see a lot less ambitious things going through because we have to sort of work through everybody and make sure we have good consensus, which is probably good in an election year anyway, because this year we have at least 4 tight races in our Senate in Jefferson County alone. And so we don't want to be putting Senators Kerr, John, Nicholson, or who is my 4th one? Why am I blanking? No, she's not running. Zenzinger, the new one. In a position of having to vote on something that will be difficult for them. By number, Senator Nicholson's race is the tightest, with about 50.1%. But I think Senator Zenzinger's is the one to watch because Senator Hudak won by under 500 votes, and there were 2 candidates on the ballot against her. And so if they get it together to only have one, it may be harder. But in terms of the legislature, because that's outside the legislature, you know, I'm really pleased at how many women we have in the Senate and women in leadership. We have, it's Women's History Month, that's why I started there. We have Senator Raleigh Heath as our token male, and he's frequently blushing at our leadership meetings, as we're talking about. And he grew up as in a different era, and he was very much a gentleman, and not that he doesn't, obviously, with his wife being Josie Heath, understand how powerful women can be. It's just funny because he's such a gentleman, and there we are, you know, being wild women. Anyway, yes, sir. Ma'am.
It's okay.
This morning.
You know, gender aside, I was going to ask a gender question, though. What percentage of the senators are women?
We were at as high as 15 or 16. We're down to 13. 13 are women and 22 are men. And so we've lost and I should probably redo that count, because that might be just Dems, and there are 2 on the Republican side. So there are 2 Republican women in the Senate. One is very moderate, the other is very Tea Party. But we had more before, and we were down there as well. And in terms of legislation that you're still going to see coming up, there are a number that are waiting because we're waiting for our budget forecasts, which is going to be reported this week. I believe the 18th, maybe next week.
Thursday.
We'll get, is it this Thursday?
Yeah,
Okay.
I heard it was going to be Thursday.
Thursday, okay. There's the marijuana forecast.
That came out yesterday.
That came out yesterday, and then there's the general budget forecast that's going to come forward. And once that comes forward, a lot of the legislation will start moving. Our focus in the Senate this year was going to be on education and families, and so Section 1 is the big bill where we're going to be allocating another $100 million to higher education. And in addition, with respect to education, we've done another number of other bills related to higher education, including allowing some limited 4-year degrees at community colleges in more technical fields. And we're also looking at trying to put more money into our schools besides what the governor had already planned to put in to help reduce the negative factor. And so there's a lot of focus on education this year. The other thing for working families is child care. And we're wanting to increase the robustness of our child care assistance program because, as many of you know, it can be really a daunting price to get over once you get your first job to get your child in child care, be able to continue working. And even for couples, it's still expensive. Colorado has one of the highest costs, particularly in infant care, for child care in the nation. And so we're working on that. At the same time, we do have organizations on the outside continuing to work to expand the quality of our child care. You hear a lot of discussion, but probably not much action this year because of funding on preschool, particularly for high-risk kids. I think Senator Kerr, who chairs our education committee now that Senator Hudak resigned to allow us to keep the majority, he is interested in seeing if we can get to full-day kindergarten this year. So we'll see what happens with all of this and where it ends up. So education and families are the majority of the things that are being worked on. As you know, my area of interest is healthcare, and I've been involved in some discussions with the Commissioner of Insurance and Senator Gail Schwartz from the Western Slope about the high rates that they're seeing in our mountain communities, which are particularly burdensome for the workforces that live there. And then towns like Leadville, which you don't think of as a booming metropolis, have really high rates. And so we're hoping to introduce a late bill to provide some extra subsidies for people in those areas to help get them through the next 2 years. There's some money left from Cover Colorado that we want to use to do that. And then the commissioners doing a study and gathering data to see what else can we do to decrease the rates in general. And so, I wrote an interesting little blurb somewhere yesterday. I hadn't thought about this, that in a lot of these communities, if you get really sick, they have to send in the helicopter to take you away, and immediately that's a $5,000 cost. And so because I was wondering, why is it so expensive? Sometimes it's just there's one surgeon or one hospital, so they pretty much get to say what their price is, and the insurer has to pay it or not. And then other times it's things like this, that just the cost to take care of somebody and get them out of that area is so high. So the commissioner is convening people to bring in some suggestions about what we can do about our rates in mountain communities. And I'm putting the final touches on a draft to have a commission on healthcare costs, to look at affordable healthcare. The thought being to bring together all the forces that are lobbying down at the Capitol around healthcare to come to agreement before we bring anything to the legislature, or on things that might be able to be done outside of the legislature to control costs. I was a little bit late because I heard that there was an NPR thing today on my rural medicine bill that I'm doing with Senator Nicholson, but I didn't get to hear it. But we're trying to get more physicians trained in our rural areas because 60 to 75% of the ones who train there stay there. Yeah. So we want to build up our rural workforce capacity because a lot of the doctors there now are older. And I'm doing some other things, but let me take your questions. Go ahead, Joan.
Can you tell me what we can do to increase the Latina participation in the affordable health care?
The exchange actually has hired Servicios de la Raza, which does a lot of things, and other culturally competent groups to do their outreach, and I'm not sure what the barrier is that they're running into. I think for a lot of people, if you never bought health care, even $200 a month can seem like a lot. And well, it depends on your income, but yeah, it is. I mean, that's $2,400 a year that you never spent before, and if you're barely making it with your, how rents are, especially in the metro area and everything else, it's just a lot of money. And so I think for a lot of people, there's still sticker shock. And then you look at the product that you bought, and your co-pays and deductibles are high, and you're thinking, why am I spending that money when I'm never going to be able to afford to use it? And so I am still an advocate for a universal health care system in our state. And if you go to cooperatecolorado.org, you'll see sort of the grassroots effort going on. I'm excited because they were able to hire Corrine Fowler, who was working for the Colorado Progressive Coalition, to be our organizer, because the hope is that we can do a ballot initiative next year. Because I think this is beyond the capabilities of the people in this building to think about, to be honest. But I think everyday people who are experiencing this when they go on to Connect for Health, I'm much more open to the idea of saying, let's check this and try again and do something different.
Well, Vermont is going to start universal health care in 2015.
Well, they're hoping also they're in transition, so they're trying to do little things to get ready for it. But the waivers at the state level from the Affordable Care Act start in 2017.
Oh, okay.
So that's their hope, is to be able to be up and running.
Be
But they already
curious to
have
see how
a group
they-
together working on it and trying to figure out all the intricate issues on the way up.
I'm interested in liability for doctors, given the mix of Access Colorado and outlying doctors and your expertise in the area. You say physicians are staying in those mountain communities largely. What about a place like Lamar? Or,
So actually the director of the Community Health Center in Lamar comes up here not infrequently to lobby on something. And he said they're doing very well right now with their staffing. So they've been able to hire and recruit people. People who work there do get loan repayment. And so that's a help because it's an underserved area. And so in addition to training programs, we have loan repayment in our state, either through National Health Service Corps for people who get that, and the president just announced he's going to be expanding the National Health Service Corps program, or we actually have a Colorado equivalent that pays for doctors in certain rural areas to get their training here in our state, who get work here in our state. It's like $35,000 a year in loan payback for every year you work in an underserved area in our state.
Thank you. Is liability an issue, or is that a red herring?
You know, it's not an issue as much in our state because we have malpractice caps, both for personal, for like the emotional injury and for the other things that other states don't have. And if you look at sort of a ranking of states in malpractice, Colorado is usually close to the top 5 in terms of being a good malpractice environment to work in. You know, it's harder for doctors though, because whether or not you actually get successfully sued, it's really traumatic to have a malpractice suit psychologically. In fact, I was at a dinner with Ted Clark, who's the physician director of COPIC, our largest malpractice insurer, and he said they're starting a support program for people who are being sued because they've had 38-year-old doctors quit practicing because they've been sued. And sometimes, I mean, you do make a mistake and something bad does happen. And I think it's hard to get past that and say, you know, what have I learned? How can I keep going? So I think that part of it may be more of an issue, but overall our liability climate is not that bad. There are exceptions. OB is always a bad liability climate, and neurology, neurosurgery, things like that. And that's because of the permanency of the damage. Because when they look at settlements, it's what happens to you for the rest of your life. So obviously as a child, you have the whole rest of your life. And then with neurology, it often impacts your ability to work.
Back to the workings down here. You learned how to navigate getting a bill across in the last few years with the opposition and getting a modicum of support. But let's say your coalition of the lobbyists doesn't come to fruition. That's a whole group that you have to either mollify or find a way to get on board with your legislation. How do you see that changing with the change in the ratio and such?
Well, as some of you may know, and I won't name names, we have some Democrats who are more moderate than others in the Senate. And so I have one bill right now, where literally yesterday I sat with the chief policy person in the minority office and Senator Ted Harvey from Douglas County to talk about the merits of the policy, because I had people in my caucus who were not supporting it because they had made a commitment to the lobbyists for the other side. I'm like, oh, okay. But, and so, you know, I think that if there's merit in the policy, it's worth having the discussion and seeing if you can get there with them. So, and I'm not afraid to sit down and talk with them. There are ways in which our values differ, but there are many ways in which our values are the same.
I'm glad you're finding that out and finding how to navigate through those, because you've been very important, especially for older Coloradans. You really need all the help we can get.
Well, there are certain issues that are not so partisan. Usually things that benefit seniors and people with disabilities, you can usually get pretty good support for. It's when you get to younger people and healthcare, immigration, that it's harder to find common ground. And voting rights. It's a very hot topic this year. That's sort of the biggest, I would say, area in which we're split, is that there's always a little bit of tension between participation and getting people out to vote and integrity. and the evidence for one is pretty clear, the evidence for the other is anecdotal, and so never the twain shall meet.
Is that split within the party, or, okay.
No, that's something we can usually get through in party lines, but it's unfortunate that it's party line.
Yeah. I know you had a voter suppression bill 2 or 3 years ago. Is this a better climate for being able to get something like that through?
No.
No? Okay.
But, you know, we did a huge voter modernization act last year, and a committee met over the interim and said there are some changes we need to make to that, and we're dreading when we make those changes because it will end up becoming a big, I hate this whole thing, discussion. So, yes.
So what percentage of the marijuana money is already tagged? And what percentage of the marijuana money is like early education or something? Or maybe even health education for...
You mean non-marijuana education?
Yeah. So there's a couple of different things. First of all, there are a couple of different funds. There's the state tax, and then there's the excise tax, and there's city taxes. So your city gets to decide what they do with the city tax. So Denver will be getting a lot of city taxes in because we have probably the largest number of dispensaries. The first cut of the taxes has to go toward running the program. So the Department of Revenue, the inspectors, the infrastructure that's needed to collect the revenue and things like that. The next part has to go to the first $40 million above that has to go to school construction. It was designated by the amendment that $40 million would go to BEST, that's building safer schools. It's basically building better schools and school construction. And then above and beyond that, the governor has put out his proposal to where he thinks the money should go, and we'll be making a presentation tomorrow afternoon to the Joint Budget Committee. And what he has proposed is, I think, a slight disproportionate to me amount of money toward education. I mean, it sounds a little bit too much like a Just Say No campaign, but a lot of stuff around education, including driving, you know, don't drive, sort of like a don't drive drunk kind of thing, but with stone driving. And then he has put money, though, into substance abuse treatment and also into schools and school counselors for mental health. The one thing he's done that I find very controversial, and I hope that we can not support, is he's put a significant amount of money into putting school resource officers, which are policemen, in all the schools, and I don't at all support that, frankly. And so I'd like to see his focus go more toward providing good mental health for our youth, particularly in middle and high school. I think a lot of times the poor performance in school and the bad behavior is a reflection of something else, and they don't have the resources to sort of deal with that. But a lot of it is sort of, and the governor in his proposal of how to spend it wants to set aside 16% of what's anticipated because he doesn't want to count his chickens before they hatch.
Okay, I hate to interrupt, but we've had